Hi. Now, this is the third talk of healthcare communication skill series, and in this talk, we will discuss brief things about patient interviews and history taking and talking with the patient while examining the patient. So, as you all know, that listening is a very diagnostic tool, and 70% of the history is diagnostic, and the other things like X-ray, MRI, labs are the adjunctive aids for the diagnosis. So, what is history taking? History taking is a form of asking questions and listening to the complete answers. And most of the time, when we talk to the patient, we think sometimes about a chunk of the patient's discussion is useless sometimes. But in this useless, we can find some important clues about the diagnosis. So, good history makes 70% of the diagnosis, and good interviewing saves time, and it reduces the errors and builds trust among the physician and the patient, and also with their attendant. So, when we do a when we take a good history, in this good history, which is composed of a very good information about the patient's ailments, start of ailment, and what is the current status of the patient's ailment. So we gather the accurate data and understand the patient concern along the lines of the while the patient is talking to us, and the patient's attitude while talking, patient's impression while talking, how it influences our asking questions. So, in this way, we build a partnership between the patient, even with their attendants, and we show them that we are concerned about their ailment and we are trying to achieve a platform where we can establish their diagnosis and try to get rid of their ailments and try to get rid of the problems which he is having and try to find out the answer for their ailments. So initially we start with the open questions and listen to the patient without interrupting them. When we gather the information, we try to clarify this information with a small subset of questions and try to clarify these questions and summarize them. Summarize sometimes in the patient's own words by repeating itself and confirm that he is saying the same thing, and sometimes in other words, so that the we confirm that we have understood the same thing as the patient wants to communicate to us. So tell ask the patient, tell me more instead of why this happens, why it is going on this way, or if even if you tell why it is going on like this way, you have to get the impression that what the patient is thinking about his or her own ailment. So first, when you start the history, you have to introduce yourself, you take the consent, then we are trying to ask the questions. Sometimes these questions are irritating, sometimes these questions uh, enter the privacy of the patient like this, some questions which are extremely private questions, or sometimes the questions looks that they are not related to the patient's ailment, but sometimes they are very much important. So you ask the questions with open narrative. The focus of the question is towards the ailment, and towards the management of the patient's ailment. And at the end of the history taking, or at the end of the this discussion, we will summarize. You have to summarize the questions with their answers and what is the patient's own concern about these. We come across sometimes the anxious or talkative patients. We have sometimes language barriers, time constraints. For this, we have to show the patience. And if there is a language barrier, we have to use the interpreters. Sometimes the patient is too much talkative, so instead of interrupting abruptly or rudely, we can direct their questions towards a focused area so that we can get most out of their own talk. So, when we are talking to the patient, we should use a plain language, simple language, not the medical jargons. Repeat some questions in summarized way so that we should get understanding clearly of the patient's answers, and we can tell the patient that did I understood you right, or you want to modify that answer. So, a good interview is both art and skill. Listen to understand, not just listen to ask another question, not just listen to reply. It leads to empathy, and empathy improves accuracy. The best clinicians are the best listeners. So, when you go for a history taking, it is a interview, interview with patience and empathy. This finishes our talk about the health care communication skill series third talk. We'll meet with the fourth talk. We will elaborate this topic more. Thank you.